HIV, or the human immunodeficiency virus, attacks the body's immune system. This virus specifically targets and destroys CD4 cells, which are a type of white blood cell that plays a major role in protecting the body from infections. The immune system is our defense against infections. It is a complex network of cells, tissues, and organs that work together to protect the body from harmful invaders like bacteria, viruses, and other pathogens. HIV weakens this defense, making it hard for the body to fight off illnesses. As the virus multiplies, it gradually destroys more CD4 cells, weakening the immune system further, and leaving the body vulnerable to a wide range of infections and diseases. When HIV is not treated, it can lead to AIDS, or acquired immunodeficiency syndrome. AIDS is the final stage of HIV infection, where the immune system is severely damaged and the body can no longer defend itself effectively. AIDS is the most advanced stage of HIV infection. At this stage, the immune system is so badly damaged that the body becomes susceptible to opportunistic infections and certain types of cancers that it would normally be able to fight off. People with AIDS are very vulnerable to serious infections, even from germs that don't usually cause illness in healthy people. These infections can be life-threatening and require immediate medical attention. These are called opportunistic infections. They take advantage of the weakened immune system and can cause severe health problems, further complicating the lives of those affected by HIV/AIDS. HIV/AIDS can affect many parts of the body, including the mouth. Oral health issues are common and can be among the first signs of HIV infection. Oral health problems are common in people living with HIV. These issues can range from minor irritations to severe complications that impact overall health and quality of life. In fact, they are often among the first signs of the disease. Early detection and treatment of these oral health problems can help manage the overall impact of HIV on the body. These problems can range from minor annoyances to serious complications. Conditions like oral thrush, severe gum disease, and painful mouth sores are common, and can significantly affect a person's ability to eat, speak, and maintain proper nutrition. One such problem is dry mouth, a condition that can significantly impact quality of life. Dry mouth can lead to difficulties in chewing, swallowing, and speaking, and can increase the risk of tooth decay and gum disease. Dry mouth, also known as xerostomia, is a common side effect of HIV/AIDS. It occurs when there is a decrease in saliva production. Saliva plays a crucial role in maintaining oral health. It helps us chew and swallow food, protects teeth from decay, and controls bacterial growth. When there isn't enough saliva, the mouth becomes dry and uncomfortable. Despite its prevalence, dry mouth is often overlooked or dismissed as a minor inconvenience. This is unfortunate because untreated dry mouth can lead to a range of complications affecting both oral and overall health. It's important to remember that dry mouth is not just an uncomfortable symptom, it's a sign that something is amiss and needs attention. Several factors can contribute to dry mouth in individuals with HIV/AIDS. One of the primary causes is the virus itself. HIV attacks the immune system, which can lead to inflammation and damage to the salivary glands. These glands are responsible for producing saliva, so damage to them can significantly reduce saliva flow. Another major contributor to dry mouth is medication. Many medications used to treat HIV/AIDS, as well as other opportunistic infections, can have dry mouth as a side effect. These medications can interfere with saliva production or increase fluid loss from the body, leading to dehydration and a feeling of dryness in the mouth. Other factors that can contribute to dry mouth in people with HIV include poor nutrition, stress, anxiety, and smoking. Dry mouth can manifest in various ways, and its symptoms can range from mild to severe. It's important to recognize these symptoms early to manage the condition effectively. Dry mouth, also known as xerostomia, can be more than just an inconvenience. It can significantly impact your quality of life. One of the most common signs is a persistent feeling of dryness or stickiness in the mouth. This can lead to an increased need to drink water frequently, as the body tries to compensate for the lack of saliva. The mouth may feel like it's lined with cotton wool, and swallowing may become difficult. This can make eating and drinking a challenge, and you might find yourself avoiding certain foods. The tongue may also feel dry and rough, making it hard to speak or taste food properly. This can affect your enjoyment of meals and your ability to communicate clearly. Other symptoms include a burning sensation in the mouth, especially on the tongue, which can be quite uncomfortable and persistent. Bad breath that persists even after brushing and flossing, is another common symptom. This can be embarrassing and affect your social interactions. Cracked lips or sores in the corners of the mouth can also develop, making it painful to open your mouth wide or eat certain foods. Some people with dry mouth may also experience difficulty chewing or swallowing, which can lead to nutritional deficiencies if not addressed. This is especially true for dry or crunchy foods, which can be particularly hard to manage without adequate saliva. Hoarseness or changes in their voice can also occur, making it difficult to speak for long periods. Additionally, people who wear dentures may find them uncomfortable or even painful to use due to the lack of moisture in the mouth. Managing dry mouth often involves using saliva substitutes or humidifiers to keep the mouth moist. Staying hydrated and avoiding caffeine and alcohol can also help alleviate symptoms. If you experience any of these symptoms, it's important to consult with a healthcare professional. They can help determine the underlying cause and recommend appropriate treatments to improve your quality of life. Section 5. Complications. Why addressing dry mouth matters. Untreated dry mouth can lead to several complications that can significantly impact quality of life for people living with HIV/AIDS. This condition, also known as xerostomia, is more than just an inconvenience. It can have serious repercussions if not managed properly. One of the most concerning complications is an increased risk of oral health problems. Without adequate saliva, the mouth becomes a breeding ground for harmful bacteria, leading to tooth decay and gum disease. Saliva plays a vital role in protecting teeth from decay-causing bacteria. It helps to wash away food particles and neutralize acids produced by bacteria in the mouth. Without enough saliva, the risk of cavities, gum disease, and tooth loss increases dramatically. This can lead to a cycle of ongoing dental issues that are both painful and costly to treat. Dry mouth can also make it difficult to eat, leading to malnutrition and weight loss. When chewing and swallowing become painful, individuals may avoid eating, which can result in a lack of essential nutrients. It can also affect speech, making it challenging to communicate effectively. This can be particularly distressing in social and professional settings, where clear communication is essential. Social situations may become uncomfortable due to bad breath or difficulty speaking. This can lead to social isolation and a decrease in overall quality of life. In addition to these oral health issues, dry mouth can also contribute to overall dehydration, fatigue, and a general feeling of unwellness. Staying hydrated is crucial, but when the body cannot produce enough saliva, it can lead to persistent dryness and discomfort. Addressing dry mouth is essential for maintaining overall health and well-being. Consulting with healthcare professionals can help manage symptoms and prevent complications, ensuring a better quality of life for those affected. Section 6. Staying hydrated, your first line of defense. Managing dry mouth starts with simple lifestyle changes, and one of the most effective is staying well hydrated. Drinking plenty of water throughout the day helps to keep the mouth moist and stimulates saliva production. It's recommended to sip water frequently, rather than drinking large amounts at once. Carrying a water bottle and taking regular sips throughout the day can be helpful. Avoid sugary drinks like soda and juice, as these can worsen dry mouth and contribute to tooth decay. Opt for water, unsweetened tea, or diluted fruit juice instead. Section 7. Oral hygiene practices for dry mouth relief. Maintaining good oral hygiene is crucial for everyone, but especially important for individuals with dry mouth. Brushing twice a day with fluoride toothpaste and flossing daily helps to remove food particles and bacteria that can thrive in a dry mouth environment. Use a soft bristled toothbrush to avoid irritating the gums, and a fluoride toothpaste designed for dry mouth. These toothpastes often contain ingredients that help to moisturize the mouth and stimulate saliva production. Rinsing with an alcohol-free mouthwash after brushing can also help to freshen breath and remove debris. Section 8. Medications and lifestyle adjustments. If lifestyle changes alone are not enough to manage dry mouth, talk to your doctor. There are medications available that can help to stimulate saliva production or alleviate the symptoms of dry mouth. Your doctor can help determine if these medications are appropriate for you and discuss potential side effects. In addition to medication, certain lifestyle adjustments can also help to reduce dry mouth. Avoid smoking and using tobacco products, as these can worsen dry mouth and damage oral tissues. Limit alcohol consumption, as alcohol can dehydrate the body and exacerbate dry mouth symptoms. Chewing sugar-free gum or sucking on sugar-free hard candy can also help to stimulate saliva production. Section 9. Prioritizing oral health for improved well-being. Dry mouth is a common and often overlooked symptom of HIV/AIDS, but it's essential to remember that it's not something you have to live with. By understanding the causes, recognizing the symptoms, and taking steps to manage and treat dry mouth, you can significantly improve your oral health and overall well-being. Remember, taking care of your oral health is an important part of managing HIV/AIDS. Don't hesitate to talk to your doctor or dentist if you are experiencing dry mouth or any other oral health concerns. They can provide guidance, support, and treatment options to help you maintain a healthy mouth and improve your quality of life.